everyone. Good morning. Welcome to our final staff town hall of 2021. I'm Hallie Nicholson, HR Strategic Communication and Engagement Manager, and I'll be your moderator for today's town hall. As usual, we've got a great group of panelists with us to answer your questions and provide some updates on operations during the COVID-19 pandemic. Some of the questions were submitted in advance during registration, and we'll also be taking questions in writing using the Q&A feature at the bottom of your screen today. We've got folks behind the scenes answering those questions in writing, so please do feel free to take advantage of that feature and to peruse the questions that others are asking. Due to our time limitation, we will not be able to get to all of your questions, but we will log the questions as they come in and post the answers on the Return to Learn website. Today's webinar has live closed captioning in two ways. First, you can click on the closed caption button at the bottom of your Zoom window and select Show Subtitles. Or you can also click on the link that will be pasted into the chat in just a moment. So with that out of the way, I'd now like to introduce Chancellor Pradeep Khosla for some welcoming remarks.
Thank you, Haley, and good morning and welcome everybody. As you know that we've been back in business, teaching in person for this whole quarter now, and from where I sit and based on the reports I get, the campus is doing extremely well. Even with the new Omicron virus, our infection rates have been contained. Now, there's always a concern about a new virus, but instead of telling you more about what the concerns are and should be, I'm going to limit myself to saying what our strategy is going to be. So unless we hear from our scientists, which is Natasha Martin, Dr. Chip Schooley and others, Dr. Martin, Dr. Schooley and others, our strategy is to keep the course. Until there is a good base, science-based reason to change the course, we are just going to keep at what we are good at. We're going to keep on encouraging vaccinations, encouraging testing, including switch testing, and also very strongly encouraging our booster shots. We have put special facilities in place for that, and I hope each and every one of you who's vaccinated twice is ready to get a booster shot ASAP. There's a lot of good people on the call today, so let me just say thank you to each and every one of you. I can tell you that without your strong collaboration, without your support, and without your resilience, we would not have had a successful year that we had. So from the depth of my heart, I'm saying thank you, thank you, thank you. Keep up the great work, and we are here to support you. And then back to Haley now.
All right, thank you so much, Pradeep. So before we jump into our presentations, we'd like to share a short Return to Learn midterm video update with you. So roll the footage.
In September, UC San Diego welcomed our students, our faculty, and our staff to our campus for the fall quarter. Many of you were ready. Some of you were nervous. But together, we returned to learn in person for the first time in more than 19 months. And backed by science and guided by our flexible return to learn strategy, we have arrived at this moment. We have been resilient. You have been resilient. We have adapted. You have adapted. We have learned together that we can overcome any obstacle.
We still must remain vigilant. The safety of our staff, faculty, and students continues to be our top priority. Throughout the pandemic, our campus is one of the safest places to be. This was in large part because of the innovative and collaborative approach that is part of our DNA. We proved that we know how to do this.
There is a big team of people working on campus every day to make sure our campus is safe.
Our teams have done a great job adapting spaces to keep us safe.
We're doing what it takes to keep our community safe.
Our flexibility and our resilience have contributed to our success. Throughout the pandemic, positive case rates on campus were consistently low compared to regional and national case rates. Since the beginning of the fall term, our campus rates have remained low. We are already making updates to our campus safety protocols guided by data and the evolving science. We will continue to evaluate and adapt based on principles of health, safety, and equity. We are confident that our return to learn strategy will continue to keep our campus safe.
We adapted.
We became Zoom meeting experts.
We were leaders.
Many of us were able to work and teach very effectively in the new remote environment. And some of us continued working and teaching right here on campus. All of us upheld our commitment to delivering on our mission as a student-centered, research-focused, and service-oriented university.
Keep up the great work.
Keep up the great work.
Keep up the great work.
We are here to support you. We will make sure you have access to the resources and support you need.
We learned so much during this time, how to care for one another and how to build and sustain community.
UC San Diego has always offered a unique and special experience for our students and our entire campus community. Our success throughout the pandemic, low case rates, and our ability to increase the number of students returning to campus each quarter is a reflection of the remarkable commitment of our students. We've been a leader in our efforts to this point, and we can continue to lead with your help. Follow the health guidelines. Mask up.
There is such great energy on campus.
I'm really enjoying connecting with the students again.
We set a high bar for what it means to be Tritons.
I'm really glad we're back to doing what we do best, which is shaping the future and transforming lives.
Thank you for your flexibility as we continue to assess and adapt our campus strategy protocols based on data and the evolving science. We see that our entire campus is motivated and willing to do what is best for our community and our students. Thank you for your commitment to one another. Thank you for rising to the challenge. Our best days are still ahead. Together, we will continue to innovate. Together, we will thrive. And together, we are Tritons.
It really is pretty incredible to reflect on the past year and a half to almost 2 years in the journey together that we've been on. So to share some more reflections, I'd like to welcome our first presenter and the host of our town hall today, Pierre, our Vice Chancellor, Chief Financial Officer, and Interim Chief Human Resources Officer. So take it away, Pierre.
Thank you very much, Hallie, and it was a very inspiring video. I just want to take yet another moment to take a turn and think about 2021, which yet again was quite a year. We have been through a lot together as a committee, both this year and last year. And I wanted to recognize what it took from all of you in terms of adapting to rapidly shifting demands. We had to respond, adapt to the pandemic. We had to navigate complex and challenging system implementations. We dealt with a very significant housing crisis, which impacted our incoming class of students, and we managed to help them out through that. We have been facing a very tumultuous political and societal landscape, and I could go on and on. In my time serving as Chief Human Resource Officer over the last couple of months, I continue to be really inspired by the resilience and tenacity that I see in all of you, whether you're frontline staff or whether you're professional, whether you're on campus or working remotely. And when I cannot deny that we're still facing a lot of challenges, both at work and for some of us at home. There is still a lot to celebrate and to be grateful for. And I think you saw some of it during the video. So last week in my message to you, I did ask you to share what you are proud of in accomplishing over the last past year. And thank you very much to all of you who contributed. It was very inspiring to read all the submissions, and I just want to share a few quotes that I think are great examples of the way our committee responded. And thank you, Hallie, for showing them on the slide. And if you read these quotes, there is a lot to be proud of. Together, we rose to the challenge of keeping our community safe and healthy. We processed a record number of student applications. We built very innovative new systems and processes to support our Return to Learn program. I think we provided a record amount of financial aid to students who needed it the most. And we stayed very connected as a community. So these are just a few examples. Again, I let you read both slides. I think there is another one, Hallie here. Thank you. And I just wanted to know how proud I was to work alongside you and how very grateful I am for all your contribution to UC San Diego. So as you finish reading the slide, I wanted to send you my best wishes for a wonderful holiday season. I hope you take time to rest, to reconnect with family and friends. And I very much look forward to continuing our work together in the coming year. Thanks again, and back to you, Hallie.
All right, thank you so much, Pierre. And it is great to see kind of some of these reflections from folks on everything that they've accomplished over the year, whether it's kind of some personal milestones, like this person who completed a certificate program, and things that we've done with our departments and our units. So thanks again to everybody who submitted all those. So let's jump into our update portion. And so up first, I'd like to welcome Dr. Natasha Martin, Professor of Medicine, who's going to give us an update on the pandemic.
Thanks. Good morning, everyone. I'm happy to be here to update on the pandemic. So as you can see here in the United States, we've just crossed about 49 million cases, and there have been increasing cases since the Thanksgiving break, which really echo the increases we've already seen throughout the European Union and really Northern European countries as cases have increased while people have spent more time indoors through the winter months. Next slide. Of course, the world is very closely looking at what's going on in South Africa, where their recent increase in cases appear to be related to the Omicron variant, and I'll discuss that more in one moment. Next slide. State-wise, you can see that in the United States as a whole, the increase in cases that we've seen are primarily driven by increasing case rates in states like New Hampshire, Vermont, and Minnesota, again, northern cold weather places where people are gathering more indoors. We saw a dip in cases in California right over Thanksgiving, I think predominantly due to the lack of testing. It's bounced up again, and we're closely watching that to see if it increases over the coming months as we anticipate. Next slide, please. Here in San Diego, the situation is good. We have a high vaccination coverage, so I think that's a good situation in terms of meeting the challenges in the next few months. At UC San Diego at the top, you can see we have 96% of our students fully vaccinated, as well as over 92% of our campus employees. At a county level, 75% of the San Diego County residents are fully vaccinated, with 85% with at least one dose. So I do think that places us in a better position to weather what is coming next over the next few months. Next slide, please. So focusing on Omicron, this is data from South Africa, where as you can see over the last couple of weeks, they've had a rapid increase in cases. This was first detected in the Gauteng province, which contains Johannesburg and Pretoria. And so they also saw a rapid increase in cases, which was quickly seen in other provinces around the country. Next slide, please. They've also seen an increase in hospitalizations. This is hospitalizations for SARS-CoV-2 in South Africa again, and monitoring this closely to see how this unfolds as the Omicron variant progresses. Next slide, please. So very quickly after identifying this increase in cases, due to the robust sequencing efforts in South Africa, they identified that this was attributable to a new variant we had not seen before, B1.1.529, now called Omicron. And this variant is unique in that it has a number of mutations, over 30 in particular, associated with the spike protein, which is the part of the virus that attaches to human cells. And these many mutations have been associated both with resistance to neutralizing antibodies, including therapeutic monoclonal antibodies that we have. They also have mutations associated with more efficient cell entry, meaning that the virus may be more transmissible as a result. There are some mutations that are similar to ones that we've seen before, such as in the alpha variant, which are associated with evasion of our innate immunity, which could also enhance transmissibility, and other mutations associated with increased infectivity. So we're still learning about what each of these mutations mean together in terms of this variant, but it is very likely to be associated with potentially increased transmissibility, increased immune escape, and reductions in therapeutic efficacy. Next slide. So here, this is the just showing you how quickly this variant expanded to become the majority of cases, that proportion genomes. Here you can see the Omicron variant in blue very rapidly within a matter of basically 2 weeks becoming the majority of variants observed in South Africa. Next slide. And we have rapidly then detected this variant in many countries worldwide. This was data as of yesterday, 55 countries. I think that has gone up to 57 as of this morning, countries which have detected the Omicron variant. Next slide. And the United States, as of yesterday, had 19 states, I think with the addition of Florida this morning, making 20 states that have detected Omicron. Within California, it has been detected in San Francisco among actually several individuals. We have not yet detected it in San Diego, but I think it's safe to say that it is very likely here or will be here in the very next few coming days. And I think we are well poised to detect that on campus as soon as it arrives through our sequencing programs, both across the campus, across the county as well as on campus. Next slide, please. So just in summary, the Omicron variant was a new variant. It was first detected in South Africa just only a couple weeks ago. We still have a lot to learn about it in terms of the mutations and how they actually affect transmission and immune escape in the population. But based on the mutations that we have seen before, it is likely that this variant will be resistant to neutralization and be somewhat evasive of the innate immune response. It rapidly became the dominant strain in South Africa. It's less likely to be well neutralized by antibodies from infection with prior strains, current vaccines, and monoclonal antibodies. The good news is that this morning, the New York Times was reporting that Pfizer released data that individuals that had been boosted with the Pfizer vaccine showed a high level of antibody response to Omicron, the Omicron variant, indicating that that boosters could potentially be very effective at preventing infection. But I think we still need more data. Antibody response is only one part of that. We need to see how well this translates to the real world, but there is an early indication that boosting may provide a good amount of protection. So we still recommend that people get boosted. In terms of disease severity, we have a lot to learn. It appears that among the vaccinated population, especially the boosted population, that the virus is acting like it might be more like a breakthrough infection with Delta strains with mild disease. I think we still need to learn as we see more people, especially vulnerable people, get infected with this particular variant. It's likely to be more severe in elderly and immunocompromised individuals, and it could potentially be a major problem for unvaccinated individuals, underscoring the importance of getting vaccinated if you're unvaccinated and boosted if you have been vaccinated. And Dr. Socia will come next and discuss those efforts on our campus along with other campus safety protocols. So thank you, and back to you, Haley.
All right, thank you so much, Natasha. So as Natasha mentioned, our next presenter is Dr. Angela Socia, Interim Executive Director of Student Health and Wellbeing. And Angela's going to give us some information about vaccines, boosters, and our campus health and safety guidelines.
Good morning, everyone. And I think as Natasha and the Chancellor mentioned, the practices we have in place have served us very well. And even with this new variant potentially coming our way, they will continue to serve us well if we all can stay strong and follow these practices. They are very effective. So let's begin with masking. Indoor spaces, because the virus, which is shed in the breath and as you exhale if you are infected, accumulates in indoor spaces. That's why they're more a problem for us, and we need to have extra precautions when we're inside. Those precautions are predominantly to be masked. If you are masked continuously indoors, except if you are briefly want to drop your mask to eat or drink, that is going to serve you very well. If you're an exposed individual, you really should keep your mask on at all times when you're in campus. If you're by yourself in an fully enclosed personal office, you may not need the mask, but be mindful if people come in and out of your office. So masking is very helpful in the indoor spaces. Outdoors, there's less of a need for masking, but think about it if you're in a very crowded situation where we will be in proximity to a lot of individuals. Think about if you're flying this holiday, or you're going to be on a train or in other public transportation settings. This is a large crowd of many individuals. Not all of them may be as adherent to masking. So you may actually want to be thinking about settings, outdoor spaces, as well as crowded indoor spaces where you want to have a mask. And the KN95s and the N95s do provide a little more protection to the surgical mask. What's important is that mask be tightly fitting. All right. Our students living on campus are now back into phase 1. So they are masking in their common areas after the fall break, and they will do so in the winter break. So they have additional masking in the residential spaces on campus. This is to keep them, because there are multiple students in suites, to protect them a little bit more. Next slide. Okay, testing. So regardless of your vaccination status, so everybody, please test for symptoms. I want to emphasize this because the symptoms can be very mild. We know that vaccinated individuals and potentially boosted individuals will occasionally have breakthrough infections. As Natasha mentioned, we're not quite sure how Omicron will behave, but we should assume that there may be some breakthrough. So your symptoms may be quite mild as a vaccinated and boosted individual, but pay attention to them. We want you to test, because if you're positive, it's very important that you stay at home and you avoid infecting others. It's also important that we reach out to the contacts so that they can be aware of it. It's through all of those efforts that we contain this virus. We protect those individuals who are vulnerable and can't get the full benefit of vaccination or have underlying medical conditions, and a breakthrough case can be very serious for them. So we need to protect each other. So if you have symptoms, you need to be staying at home and you need to get tested. And then if you're positive, we need to reach out and contain that viral spread. That is an important part of keeping this virus from spreading to others. The more it replicates, the more we're going to have variants and the more ill individuals we will have. Wastewater has worked really well to identify individuals shedding, sometimes when they're not even aware or their symptoms are so mild, they're not realizing they are shedding virus. That wastewater signal often precedes the awareness of an infection. So please test if you are working or living in a building with a wastewater signal. Exposure. If you've been exposed to an individual who is known to be shedding virus, test as soon as you're notified and on day 5. And I'll talk a little bit more about exposure down the line. But please take advantage of the testing. Who needs to test? All the unvaccinated in fall quarter are continuing with twice weekly testing, and that will continue at the beginning of the winter quarter. Be prepared for further announcements. We'll be watching the viral activity in San Diego, around the country and the world very carefully over the next few weeks. And if the assessment is that we need to modify, we will be communicating with you if more testing is needed. Our students returning after winter break will be testing upon arrival on day 5, those that are residing with us. And I would encourage all of you, if you are leaving the community, the knit family that you're used to, and going to expose yourself to multiple individuals because you're traveling for the holiday period, please test before you go and test when you return, because you may have inadvertently been exposed, and it's better to know if you're carrying the virus and shedding it than not to find out about it. So take advantage of the testing. Next slide. Where do we have testing? We have a provider-based testing if you want someone to administer the test for you at the Price Center and as well as health system sites. But the vending machines are a great way to test. They are easy access. We have 20 locations, including the 2 drive-up locations. And you can, these will be open throughout the December, throughout the break. We will not have pickups on the 25th or the 31st, but on every other day, there will be vending machine tests. They'll be picking up the result, the samples, and you will get results 24 hours later. If you don't get your results within 24 hours, please retest. Occasionally, we haven't captured your identification or there's an issue for some reason. And so always retest if you're not seeing a result. That result will come back in your My Chart. Remember, you need your campus ID to release a kit, that the kit has your instructions, the swab, the testing vial, that you have to use your UCSD app on your phone to capture the barcode. That capturing the barcode identifies the sample as belonging to you. Once you've captured the barcode, swabbed your nose, dropped the vial in the container, we'll be picking it up that day. We pick up, the last pickup is at 2 p.m. and the results will be back either that evening sometimes or the next morning. But if it goes longer, please retest. Also, return the clamshells that the kits come in. We're recycling those clamshells and trying to use them again. So plenty of access to testing for individuals throughout the break period. Next slide. Boosters. Cannot emphasize enough the importance of the boosters. It's been known with many vaccinations for other conditions that supplemental boosters are needed. Think about influenza. Every year we get, effectively, if you want to think of it, a booster. We get a new immunization because the strains vary. Tetanus, we regularly need a new tetanus booster. So the idea of needing a booster for a viral infection is not unusual, right? To prevent an infection, boosters are needed. This virus replicates very quickly and is changing. So we probably should assume we're going to need boosters for the next few years, or maybe it'll be like flu. It'll continue through our lifetime. The current boosters that are available are working very well against Delta. That is for sure. We occasionally see mild breakthrough cases, but not severe illness in those individuals who have had primary immunization as well as boosters. The encouraging news that Natasha shared this morning thinks we're going to get some benefit from Omicron. Please, I would not wait for an Omicron specific booster. There may be another virus in another 3 weeks, another variant in another few weeks. Go right now. We know you need the boosters. If you've been over 6 months with Moderna and Pfizer, the messenger RNA, and you have those 2 doses, it's more than 6 months. If it's been 2 months after Johnson & Johnson, for our international community who may have had a WHO-approved kill virus, go ahead and get a messenger RNA now. And the immunocompromised should speak with their providers. Right now, boosters are for 18 years and older. Now, there is a lot of talk about bringing boosters into younger ages, particularly 16 to 18. This will be changing and there'll be more information. We're now giving primary vaccinated to our children, and this will be helpful for them for sure. Please get your children vaccinated. And then they eventually will need boosters as well. People wonder about the mandate. Right now, boosters are not part of the mandate, but this could change because we've seen that if you don't keep your immunity up, it will wane and then you'll be back in the space of someone who's almost never been vaccinated. Maybe not exactly the same, but you'll lose lots of the protection. So please get boosted. You can mix and match. If you had Moderna in your first series, you could have Pfizer now or have Moderna again and vice versa. There are multiple sites to get the booster, the health system sites that are located throughout the community, as well as the Price Center. These are by appointment only. We've created as much availability as we can through the Price Center, and appointments it's going extremely well. They're providing boosters to over 300 individuals a day, and they are working 6 days a week to provide boosters. So please take advantage, go to the RTL site, and it's an easy log on using either your My Chart or My Student Chart to book an appointment at many of these sites. And the Chancellor's Challenge, this is wonderful. 10,000 students, if we're able to boost them by the end of the year, December 31st, there'll be a $50,000 donation to basic needs. I'm happy to report this morning, we had over 5,700 students already vaccinated in the early morning report. I bet right now that number's over 5,800. So please take advantage of boosting. Because San Diego was so early in the vaccination phase, that's been wonderful. That also means we should be in the early boosting phase. So please, over this holiday period, grab your booster. Side effects, they're kind of like when you had the initial vaccine. Some people have nothing. Some people get a sore arm. Some people are fatigued for a day or two. So a little bit of side effects, temporary, they'll be resolved. So please, again, can't say enough to take advantage of the boosters. Next slide. Just remind everybody, if you've been exposed to someone who is known to now be infected and you are unvaccinated, you need to remain off campus. Our residential students are moved into separate quarantine housing. You should test as well, only go out to get your test and test day 5 to see if you've actually converted, and monitor your symptoms very carefully. Cal OSHA does not allow you to return for employment until 10 days after your exposure moment. So with negative tests, no symptoms, you can return to work after 10 days if you are an unvaccinated individual. But if you've been vaccinated, you can continue to work. You can continue to move around the community. But please mask in indoor and outdoor spaces. When you're not in your home, I would recommend that you mask at all times. Eat alone, because remember, you're taking off your mask to eat. We do move our residential students who are exposed, even if they're vaccinated. If they have a roommate, they go to quarantine housing as well. And that has helped us minimize transmission of the virus throughout our campus community. So again, test on notification day 5 and monitor your symptoms carefully if you've been exposed to someone with the virus. Next slide. And the daily screener, please take advantage of this. We have integrated information regarding your symptom response, if you've been exposed, if you're unvaccinated and you have a testing requirement, that's also there, so that if you're not fulfilling your testing requirement, you will get a red thumb. A red thumb means you should not be on campus. A green thumb, everything's good to go. A yellow thumb will happen for the individuals who need the additional masking because of exposure and need to eat alone. So very simple 3 thumbs now. It's working very well. There was a tiny blip yesterday. Amazon server went down. The individual doing the screener got the right result, but managers had a temporary lapse in their reports, but that's all been fixed fairly quickly. So with those things, I'm going to hand it over, and then I'll be working on the chat questions and available for Q&A later.
All right, thanks so much, Dr. Socia. Our next presenter, we're going to get some updates from HR and about return to campus. So I'd like to welcome Terry Winbush, Senior Director of Labor Relations and Employee Relations. And then Terry will be joined momentarily by Amanda Chavez, Senior Labor Relations Analyst.
Thank you, Hallie. So hi, everyone. Just a few updates on things that you probably want to know and definitely need to know. So as most of you are aware and probably have giant calendars out and are marking with a really big purple, because that's my color, purple X. Winter curtailment is coming up soon. So UC San Diego, excluding the hospitals and clinics, will officially close for 7 days between Thursday, December 23rd and Friday, December 31st. 4 of those are the paid holidays. That's Christmas Eve and Christmas, New Year's Eve and New Year's. And I think those are backed up just a smidge because of the Saturdays. Policy covered staff who do not have accrued vacation to cover this time may request a one-time advance of up to 3 vacation days. Represented employees, you will operate in accordance with your collective bargaining agreement. The key during this time, because people are still asking, and I'm always fascinated by it, do we have to take time off during the curtailment? Yes. What you do with that time is your personal business. It should just not be work. And the reason is it's the time to rest, relax, and recharge. However that is done by you, that brings you joy, do that. But don't inundate people who are otherwise off by sending emails, by doing anything work related, because the idea is when the rest of the campus primarily slows down, people who take time off didn't come back to the sort of vacation email punishment that normally occurs when people take time off. So you may also want to consider, if operational needs allow in your area, to take off a couple of days ahead, because we are taking off sort of in the middle of the week, or to take off a couple of days after the curtailment, just to ensure you get enough rest, relaxation, and recharge, so that you can come back full speed and full power, ready to take on the next set of challenges. The other thing to remember is there's still a flu vaccine attestation. All campus employees and all employees, frankly, campus and health, has to submit their attestation or declination of the flu vaccine. But on the campus side, they use the flu vaccine attestation or declination form that we'll be posting in the chat. No further documentation is required. So you don't have to go back to CVS and get your receipt, or go to UCSD Health and say, can you print this out for me? Or I have to pull up something from my chart, et cetera. Just go and make your selection. If you have not made a selection, and I know there are thousands of you who haven't, The assumption will be that you are declining the flu vaccine. And when we get to a place where certain restrictions are lifted, you will still be subject to all of the restrictions like masking indoors because of that declination or the declination assumption. So just keep that in mind and go and do your flu vaccine attestation. And Hallie has lovingly put it in the chat for you all. And then there's still the COVID vaccine mandate requirement. So the adjustment that the Office of the President made is that employees who are hired on or after October 20th, they only actually get 2 weeks from their first day of employment to come into compliance by either documenting their vaccine status or requesting an exception or deferral. Now, you may be saying to yourself, well, that seems unfair. Why did people who were current employees get more time? This is because during the recruitment process, people were informed of this vaccine requirement. The vaccine mandate had been out there for a time at that point, and they were informed before they accepted jobs at UC San Diego that they would have to comply with this. So now it's just a function of them documenting whichever is their path. So that means approximately 2 weeks after their start date, or shortly thereafter, they will start getting notices of non-compliance and then potentially be subject to discipline. Now, I will tell you, when we did the first round of employees who were employed on or before September 6th, we only ended up having to engage more prescriptively with 4 employees. And so this is really good news. And I have hope that that'll be the same for this next wave of employees that we've been reviewing. The numbers are very small. I'm proud of you all for really engaging with this mandate and following the requirements. So with that, I'm going to turn it over to Amanda to give us some other updates related to return to campus. Over to you, Amanda.
Good morning, everyone. So I wanted to paint a little picture about what we look like in terms of our workforce flexibility. So this first slide gives you a little picture of what we were like pre-pandemic. 93% of our employees were working on site. They may have had some kind of alternative work schedule, but they did not have a telecommuting agreement, as we called it then, on file with the university. We had about 1% of the 7% that were telecommuting that were fully remote. So they were telecommuting as an exception to policy 100% time. So you can see that we have a lot of blue here with a lot of people on site fully during pre-pandemic. Next slide. So I did a snapshot of what our current information is based on the work location status tool. If you have not updated your work location status tool and you have a new schedule, please make sure you do that. So currently we're looking about 35% on site, 36% hybrid, and 29% remote. We are still in the process of returning to on-site work. So there are many areas that have not come back yet and still have employees remote or have a mix of some employees on-site and some remote. So we anticipate that we'll see more hybrid employees, that number go up over the next quarter, and the remote number go down a bit. At the beginning of April, when we started the return to campus process, we actually estimated that we'd have about 28% of our employees on site based solely on their job titles. So we do have more than that. It could be that we've had an increased number of some of those on-site employees, but we do anticipate that the hybrid will go up. The on-site may change a little as well as people are kind of normalizing and establishing what their work schedule looks like. As we come to the end of the quarter, it's really important that if you haven't had a conversation with your supervisor, or if you are a supervisor with your employees about their work schedule and the modality of how work is taking place, that you consider doing that. We really would like employees to continuously have conversations about their work schedule, how they're doing work, when they're doing work, to ensure that it's working for the business operations as well as for the employees' needs. And with that, I will turn it back to Hallie.
All right, thanks, Amanda. It's really interesting to see kind of the journey that we've been on in terms of workplace flexibility, where we started, where we are today, and then looking ahead. So thanks so much for that information. So before we move into our Q&A portion, I just wanted to share just a little bit of information. First of all, I wanted to say thank you for continuing to participate in these staff town halls. Looking back, they were launched, as you may recall, in July 2020 as part of our sort of kind of emergency and crisis response plan, really focusing on medical information, safety and health information. And of course, we're still doing that as the situation calls for. Looking ahead to 2022, we will be continuing our staff town halls, and we'll absolutely continue them beyond perhaps someday when they're no longer necessitated by needing to share this kind of medical and pandemic related information. So just keep planning on attending these every month. Engagement has remained really high. We had over 1,000 folks registered today, which is really great when you think about maybe pre-pandemic times. It would have been hard to get 1,000 of us together in this kind of forum. I think these town halls have been incredibly valuable in terms of keeping us connected when we're all working in different places. They've served a really valuable bridge between the staff community and our leadership. We've had very cool, if you ask me, kind of interesting access to the same medical experts that you're seeing in our news here in San Diego, Chip Schooley, Natasha Martin. So it's been a really valuable opportunity, I think, for all of us. So thank you for being here. Thank you to our panelists. I would encourage you, after the staff town hall today, you'll receive a survey, as you do every time after the town hall. Today's survey, I think especially, is a good one to tell us what you might be interested in seeing in the future as we plan for our 2022 town halls. So they will continue. We're looking at probably the first week of February for our first one in 2022. So you can keep an eye out for those details. But we look forward to continuing this time together. I also just wanted to share about a couple upcoming staff association events on behalf of my colleagues in the staff association. There's several fun things going on next week. On Tuesday, there's a staff day at the women's basketball game. It's at noon, so perfect thing to do on your lunch break. Come over to Remac Arena. All you need is your ID to get in. And I think it'll be a really special day because it's the day that the kids from the Preuss School are also attending the game. So it should be a pretty fun crowd. There's a town hall for CUCSA, which is the Council of UC Staff Assemblies. That's sort of the system-wide version of the Staff Association Staff Leadership Group. That's on Wednesday, so kind of similar forum to this, except more from a system-wide staff perspective. That's on Wednesday next week at noon. And then on Thursday, you can stop by the Student Services, the multipurpose room, the Student Services Center, pick up some hot chocolate, a little holiday gift from the Staff Association. That'll be on Thursday afternoon from 12 to 1:30. You can stop by. All those details are available at staffassociation.ucsd.edu. So we hope to see you there. So with that, I'd like to invite my panelists to come on screen, and let's move into our Q&A portion of our event today. All right, so some of the questions, there was a lot of consistency in terms of the questions we are receiving today and the questions we received in advance. Lots of questions about boosters. I saw several questions in the chat, and Angela, you may have answered these in the chat, but I'm going to go ahead and ask for everybody. What can you share in terms of boosters for, or I guess vaccines for 5 and under, and then boosters for that 12-year-old cohort? Do we know anything yet, I guess? Is the
question. We're still waiting for those to get approved. There is every reason to be optimistic. There will be a vaccination series for those under the age of 5. Similarly, I think the booster protocols will come out for those 16 to 18, may be a little sooner, and then we'll see a 16 to 12, and then maybe 12 and under. It'll kind of follow the pattern in which primary vaccination has occurred. It would be unusual to think that the pediatric response would be so different than the adult response, but they do have a good immune system. And so the timing for boosters maybe will be a little different because children generally have very good immune responses. That's why the doses are a little different in primary vaccination for children versus adults. So this will be coming out for sure. There was another question in the chat about, do we know how long this booster will last? Should we assume the next one's in 6 months? Actually, we don't quite know because this booster is now telling our immune system, okay, get ready again. And so the response may be even stronger. So maybe the next booster will be 8 months or 12 months. The scientists are working fast and furiously. It's actually quite amazing to see how much knowledge has been gained in a relatively short period. You saw the world rapidly respond to the information about South Africa, and every lab around that was in this space of COVID worked really hard. But some of these answers are going to take some time, which is why we're going to continue to be communicating with you. As our scientific community learns, we're going to share the knowledge, we'll do the adaptation.
Thank you, Angela. And again, it's just another reminder of how lucky we are to be so close to our scientific community, right? It's right here at home with us at UC San Diego. And that's been such a benefit to us all. I thought this question was an interesting one, and maybe Angela or Natasha. Is there any vision that people will be able to connect without masks in the future, even if it's 12, 18, 24 months? What might we be able to predict or guess about masking in the future?
Well, I'll leave Angela to express her opinion, but I'm optimistic that we will get there. I wish I could give you a crystal ball prediction about when that will happen. I think it will happen. I do not think it's happening anytime soon, especially as we still learn, are integrating information about the Omicron variant. But I think we can look forward to a world where we're able to kind of resume our normal activities and live alongside the virus as we live alongside, many other cold viruses that regularly circulate. But it will still be some time until we get to that point, I think. Angela, did you want to add to that?
No, I think that's well said. And I think there have been, and there will continue to be, the vulnerable community will have to do some self-care. So just like we've known, individuals undergoing chemotherapy have to be more cautious. They may need masks. So there may be individuals who will need to mask more often, but the general healthy community who's been vaccinated and boosted, sometime in the future, we will be leading that more normal life. But boy, sure can't tell you what that date is.
Right, if only we had our crystal ball. So Angela, you mentioned in your presentation a little bit of information as people are planning for their holiday travels. So one of our attendees submitted the question that says, how are we preparing for a safe return from winter break, recognizing that students and others are returning to campus? And how is the Omicron variant impacting this planning?
Yeah, I think we have to realize that most people will be traveling in this country, and Delta is the big virus. And how different Omicron is than Delta, and do you actually do your preventative steps any differently? Right now, you don't do anything differently, right? Because Delta's out there all over the place. And maybe there's a little Omicron mixed in within it, but they're just not that different. So I think that simple things you can do is before you go on travel for holiday, get tested. Before you enter into a new community of individuals you haven't been spending time with, make sure you're not bringing virus to others. So test there. When you're traveling in these public spaces, make sure you're masking, wearing a good mask, get a KN95 or an N95. These are readily available. They're not that expensive. Please take advantage of a really good mask when you're in a large setting, particularly public travel. Then when you get to where you're going and who you're spending time with, think about how many people you're exposing yourself to and what you do, right? Because that will be kind of how much risk you're taking, and you have to make that personal decision. Then when you come back to our community, test on arrival and be cautious. Maybe keep your mask on a little bit more till you get your results for that first week. Maybe test a second time when you first get here, just on the possible chance that you were exposed. That's why our strategy for the residential students is they test on arrival in case anybody accidentally is bringing virus in. Then we're going to test them again on day 5, just to make sure, right, that if they were exposed, there was a delay, that we pick that up. That's a great practice for every one of us to adopt if we're going to expand the circle of individuals who are interacting during this holiday period.
Those are all great tips. So on the topic of testing, either Natasha or Angela, I thought this was a really interesting question. What kind of home COVID test do you recommend we might use during travels? This is assuming that they don't have the vending machine available to them right then. PCR antigen, and does a more expensive test need a better test?
It's really tough. There are so many tests out there, right? I can give great confidence in the PCR tests our labs are administering, right? So there are a lot of home kits. Follow the instruction carefully. But if you are traveling with a requirement, and some places have very specific requirements, make sure you understand that, because they may not accept a self-administered test. They may not accept anything other than they may need a letter or something. We've seen that with some of our students. They need more than just, here's my test, and I can show you a screenshot. So know what you need for the travel you're going to use, particularly if you're going internationally. And I think Hawaii still has some restrictions as well. So keep an eye on where you're going.
Can I just add one thing related to another question that we saw in the chat? Somebody had read some news reports that that Omicron evaded PCR testing. And I just wanted to clarify that if you are infected with the Omicron variant or any variant, it will be detected as an infection by PCR. It's still detectable. We may need additional molecular sequencing to confirm that that infection is actually Omicron, but you will be detected through PCR methods. So it's just as a robust way of detecting infection as it has been before.
That's super good clarification. Thank you. All right, Terry, I'm going to send some questions your way. So related to vaccine, this question we got is when and what action will be taken for those staff who are not complying with the vaccine mandate?
That's a really great question. So first, I'm going to say what I always say. We do not want to take any negative action against anyone if we don't have to. The goal is for people to get vaccinated, to file their exemption or deferrals, and to comply with the policy. Now, that being said, there are some individuals who refuse to comply with the policy. Like I said during the update, at the end of the review process, we got down to 4 individuals who actually were issued discipline as it relates to not complying with the mandate. And so we will take the measures that are prescribed in the policy for non-compliance with the mandate. And we will also take measures for people not engaging in our UC San Diego requirements of testing if you are unvaccinated, even if you have an exemption or deferral, and wearing your mask when you are in indoor spaces and then the other requirements. So the key is we are taking action. We don't want to go that route. That's not a comfortable or happy place for anyone, but we will take action because this is an important health and safety issue for the world. So we at UC San Diego are trying to do our part, right? And we expect all of our employees to do their part, and we are taking action.
All right, thank you, Terry. Another question for you. Please clarify rules for food and drink at meetings. There are different rules for unvaccinated versus vaccinated, and there's no way to know who is vaccinated. So what's your advice on that question?
Yeah, and I've been talking with a number of groups about this. The key for me is when I'm advising groups is to tell them if you are not in a group of employees who are all people who report to you and therefore appear on your supervisor dashboard, you must assume you are a mixed company. When you are planning that meeting, you need to make sure that if it's outdoors and you plan to have food or drink and that's been approved by your responsible vice chancellor, okay? You need to make sure that there is distancing available so that the folks who are not vaccinated who want to partake in the food can sit separately away from other individuals since they have to unmask in order to engage in consuming the food. Indoors is even more concerning, as Angela said. The key is to try and avoid having food or drink on anything indoors, right? But to the extent that someone is drinking or eating indoors, they need to be alone. They need to be away from others. And if they're unvaccinated, they need to not be doing it at all, essentially, right? So yes, there are rules. It's hard to keep up with when you're planning your event. Talk to folks who can assist you. Check the resources on our RTL pages. They have all of the information you need about what the requirements are. Think about individuals outside of your own supervisorial domain and assume that you're going to be a mixed company and then plan accordingly. The key is to try to plan the safest event possible because the key is the enjoyment, not the after effects of potentially having an exposure for someone involved.
All right, good advice. Thank you. Okay, Amanda, you shared some information about flexible work, and that's been a consistent source of questions for us, I think, over the past few months. So here's one for you. Can we get confirmation that hybrid work arrangements are a long-term plan and not something that's just during COVID?
Through the exercise of return to campus, what we really asked supervisors to do was to look at job descriptions and employee duties and responsibilities and organizational needs with the hopes that whatever work modality people are returning to on site, it will be potentially an option for them going forward in the future. So yes, we would like to create a more flexible work environment. We've had a lot of policies in place for years, but they haven't been necessarily used to the extent that they should be. And as we do things to try to be a top employer and to really bring in and have the most engaged workforce we can, we need to embrace flexibility. And we really need to do more to have hybrid, flex time schedules and allow people that flexibility that a lot of people are demanding now. So the more that we can do to keep the new workplace of a more flexible, more hybrid, more dynamic workplace, I think the better we'll be off in the future in terms of being able to attract, retain, and really be the best employer we can be.
Hear, hear. So relatedly, another attendee asked the question, for essential workers on campus, what kind of workplace flexibility kind of perks can be provided to them, recognizing that not all jobs are suitable for kind of remote work and hybrid work?
So what really supervisors and employees should look at are those flex time options that we have. So the alternative work schedules. It may be that they can shift their schedule to start or end earlier. It may be that they may be able to have a longer lunch break if that's something they need, or even have various schedules on each day, depending on what they are. So maybe they some days come to work earlier and leave earlier, and some days they may stay later and come in later. So really looking at what those schedules options are. I know in some of the areas where there are more defined work schedules, there will be, or we anticipate that they'll be looking into kind of more flexibility with like those shift schedules and the options around that. But our focus really has been returning people on site, and any of those individuals that were on site already and continue to be on site, they're interested, supervisors are interested, leadership's interested, but they haven't been the top goal yet in terms of figuring out how creative we can be with those schedules.
All right, thank you. So slight change of topic. Terry, I'm going to send this question your way. This attendee would like to know, when will merit increases come back?
That's an interesting question. So first I will say, so last year, or during this fiscal year, there was a general increase that was approved that everyone eligible received. And the general increase essentially means that everybody who's eligible gets the exact same amount, the 3% that was issued. The merit increase, just to make sure that we're all talking about the same thing, a merit increase means that your increase, if eligible, is based on your overall performance appraisal rating, right? So you may get, if you have an overall S performance appraisal rating, your amount of increase may be different and should be different than a person who gets an E for their overall performance appraisal rating, right? So as it relates for the planning for next fiscal year and any increases, those things are being discussed right now at the system-wide level. These decisions are made by the Office of the President, and then they're implemented locally. We don't know whether this next year's increase is A, whether there'll be an increase, because people should not assume, but we are very hopeful. B, whether or not it will be a general increase or it will be a merit increase. So as soon as we have more specifics and details, we will let you all know. The key is to work as efficiently and successfully as possible. And then we will do what we can as the employer to like Amanda said, continue to try and be the employer of choice, right? Make sure that we're providing the increases consistently with our policies, and to continue to offer hybrid work options to make things a little bit more balanced for folks as they work at UC San Diego.
All right, thank you, Terry. Okay, so there was a question submitted. So we asked earlier, kind of, what are we looking for in terms of change of plans, assuming maybe the pandemic, gets worse, variants, all that. So I'd like to, this question is kind of asking the opposite. So how will we determine when we want to kind of roll back some of our health and safety guidelines, things like masking, testing requirements? What kind of indicators are we looking for? And maybe Angela or Natasha on that.
Well, I think the indicators, what we did this fall, remember we started the fall out with the vaccinated community getting testing weekly. And we saw that we could actually drop it over time. So I think we continue to watch the amount of viral activity we have. What are the strains that are spreading? What are we seeing in our employee population? What are we seeing in the students? And when viral level gets really low, we feel we can do a little less or restrict the testing to the vulnerable people, right? That we could go from no taking the mask up or down indoor spaces to allowing folks to do it briefly, which we didn't feel we could do a few months earlier. So it's the same set of, I think, signs, signals, science that are going to go into the decisions. Whether we have to step up a few things and put a few things in place that we had lifted, or we have to add a few more in. It's really not a single number or measure, because it's a complex picture, what's around us and what's within our community. So I hope that helps a little bit. I think it's the fairest way to answer the question and the safest thing to do for everybody. If we lock into crystal ball predictions, boy, this virus has thrown us for loops every time we thought we knew where we were. And those curveballs seem to be like every third or fourth pitch. I mean, you know, we thought we were in a whole different space last June and May, and then we had to adapt to Delta, but we did it. And we've done it each time. So I think the confidence in each other and in our scientists is what will guide us through this.
Great. I think my takeaway, Angela, from your answer is just reminding myself that this is all incremental, and there's kind of this desire, I think, right, for there to be an end date. It's over, everything's back to normal. And that's probably not what's going to happen, right? It's going to be kind of these, just like a phased approach throughout. It's going to be continued phased approach. What that means for us as staff, I think, is we have to pay attention to understanding that the rules are going to shift and change. And just to stay abreast of all that, I think, through events like this and reading emails.
Yeah, and this virus keeps changing. That's the challenge with letting it spread so much and letting it replicate so much, and why it's so critical that we get the globe vaccinated and the globe protected until, because the virus will adapt and it mutates naturally. And the mutations that make it more effective are the winners. And the more we give it a chance to mutate, the more it's going to come up with more and more clever ways to avoid our natural body's response or the tools we develop, whether they be therapeutic or vaccination. So we got to get everybody out there vaccinated and boosted and not give this virus much of a chance.
I totally agree with that. And I think that is a great note to wrap up our Q&A session today. We've hit the hour. So I want to thank our panelists, as always, for your participation and your transparency and sharing all your expertise with us. Stay tuned for the date of our next staff town hall early in the year next year. And then I send everybody best wishes for a restful and relaxing holiday season. And we'll see you next time.